Good afternoon, everyone. It's a great honour. It's a great pleasure to be here, and can I thank you for the invite. It's fantastic, I think, to have this conference in Farmley as a symbol, really, of how important it is for our nation, for the island, and for government that we invest in and support those living with rare diseases and our healthcare workers who are working in this area. I want to recognise my Dáil colleague, Deputy Paudie O'Sullivan, is out there somewhere. I can tell you, after 4 years as the Minister for Health, the strongest advocate I have seen in the Oireachtas for rare diseases is Paudie O'Sullivan. He explained outside to somebody that what I meant. He was explaining to somebody outside that what I meant by that was, consistently annoying, but is absolutely not the case, I can assure you. Consistently advocating is what I would say. I don't think there's a Fianna Fáil parliamentary party meeting. We have them every Wednesday. I don't think we've gone through a single one in the last number of years without this coming up, and often led by Paudie and John Lahart as well. I really want to just acknowledge Rare Diseases Ireland and Northern Ireland, the Northern Ireland Rare Disease Partnership, for coming together for this North-South event. The more we can do in terms of all-island healthcare, the better. We worked very well together during COVID, Robin Swan and myself, for example, and our officials, and most importantly, healthcare workers, North and South, works very well together, continue to work very well together. Neither COVID nor any of the many thousands of rare diseases which have been identified, they couldn't really care less about which side of the border they're on. And the more of an all-island approach we can take to supporting people, to cooperation on research and development, on medicines and so forth, the better. And I'm really delighted to see this as an all-island event. So a huge thank you to both groups. Can I also just thank the Rare Diseases Ireland group. I know ye better than the Northern Ireland colleagues, and I just want to acknowledge the tireless work that you put in. You're working behind the scenes at a huge rate. You've been advocating, you've been agitating, you have been working with patients, supporting patients and their families, supporting mums and dads who are learning how to raise and support boys and girls who've been diagnosed with rare diseases. I think the work you do is invaluable. I think it speaks to the very best of us on this island in terms of looking out for each other, in terms of local community-based and voluntary supports. So I really just want to acknowledge all of your work, your ongoing work, the work you're doing into the future on the task force, on the forum and more, and say well done for everything you have achieved so far. The theme for today, I think, is very useful, which is looking to the future for rare diseases. And I know you've had good discussion already around the science, the technologies, the medicines, screenings, and so forth. And really, that's where I want to start. Is what's our ambition in terms of health and social supports for people living with rare diseases in this country? You all know that the name rare disease is correct to a point, but in many ways isn't. In that we have 300,000 people in the country living with a rare disease, one person in 17, and I was delighted to launch the recent campaign around 1 in 17. And the point I made at that launch was 300,000 people living with a rare disease, many of them children, means that probably 1 million people out of a population of a little over 5 million in the Republic anyway, either have a rare disease or are living with somebody with a rare disease. So in fact, 1 in 17 may have a rare disease, but probably 1 in 5 of us are living in a household where somebody has a rare disease. And so really it is anything but rare. We're identifying more and more of them. We now have identified about 6,000 rare diseases, which is very useful progress. And as we all know, there's tens of millions of people across the EU who are living with a rare disease. You all know far better than I do that for the person with a rare disease, life can be very difficult. Obviously, it depends greatly on the disease. It depends greatly on the condition, but it can be very, very difficult. And in cases, tragically, it can be fatal, as we know. It's also very difficult for the families. It's difficult for mums and dads who are getting on with their lives, have probably never heard of rare diseases. They certainly won't have heard of the rare disease that their little boy or their little girl has. And they need to then frantically try and find out about the disease. Who in Ireland, who in the HSE has expertise in this? Who in the world has expertise in this? I was talking at the launch of 1 in 17 with some parents who were saying their daughter is one of 50 people in the world who has this particular disease. And this was very difficult because they couldn't find anyone to really talk to about it. They found it very difficult to find any medics to talk to about it. And they were able through Facebook to find people and to organise internationally. And they said the comfort and the support that they got from being able to reach out with and share experiences with parents from around the world whose children have these diseases was incredibly valuable to them. So it's difficult, obviously very difficult, most importantly for the person with the disease, but for mums and dads and brothers and sisters and sons and daughters, it can be very, very difficult as well. So what do we want? What we want is a country, what we want is an island whereby we can rapidly identify rare diseases as soon as possible. Les Martin and I were talking outside. I've written to the National Advisory Screening Committee about MLD, thanks to the tireless work of Les on Spinraza, which his own son died of. I know he won't mind me saying that. He's spoken about it many times. And another 5-year-old boy, Aidan Kenny, died of not that long ago from MLD. Spinraza is a life-saving treatment. Les has campaigned for a very long time, and we got it over the line just in the last few weeks. It's very expensive, and it's worth every single penny. Les and I will now be working together to ensure that MLD becomes one of the conditions that is screened for. We want an Ireland where as many conditions as possible are screened for. We want an Ireland whereby we have the medical expertise here in the country, or in many cases where we are part of an international community, be it through the European research networks or other international collaborations that make sure if our own medics don't have the information, they can tap into the expertise, be it in the north, be it in Britain, be it around the world as quickly as possible. We want an Ireland where the people diagnosed have access to the most effective, the most modern treatments to the greatest extent possible. And the developments that are going on in the pharma industry right now really are breathtaking around the speed at which new orphan drugs, new treatments are becoming available. And critically, as we were saying outside, it's not all about the medicines, it's not all about the treatment. Obviously, that's a core part of it. We need an Ireland where the social supports, the community supports, the health and social care supports are available to those living with rare diseases. That might mean in their home, it might mean via their local GP, it might mean via their local primary care centre, and then as a last resort, obviously, in the hospital setting. That's what we aspire to. Help people, work on prevention through genetic genetic screening, which is something we're investing in, be able to identify diseases early, be able to tap into the best expertise around the world when we're looking for treatment, have access to the best medicines, the best technology, the best devices, and then support people at home to the greatest extent possible. That's our vision. That's ultimately what we aspire to. And to that end, we have taken a very deliberate and a very active approach in the lifetime of this government. I was concerned with the 2020 budget in that there was no new development funding for medicines whatsoever. And so when I was appointed Minister for Health, I spoke with the National Centre for Pharmacoeconomics and others, and I said, there's a lot of medicines which are not getting approved, and we in the Dáil have been saying that it's kind of your fault because you're too slow, you're not transparent enough, it's not happening. And the answer I got back, I hadn't heard before. The answer I got back is there's no money for new drugs. There's no allocation in 2020 for new medicines. So what are we meant to do? Give reimbursement decisions on medicines that there's no money to fund. And so we moved on that very quickly. We allocated €50 million for new medicines in 2021, more in 22, more in 2023, and this year again another €30 million. In preparation for coming here today, I asked the department to give me a rough estimate as to the amount of money that will be spent just on these new medicines, on these new allocations from 2021 to this year over the next 5 years. So how much money just on the new stuff are we going to spend in the next 5 years? And don't tell Pascal Donoghue this if any of you see him. But the figure I got back was in excess of €850 million. That's just on the new medicines approved in the lifetime of this government. We spend €1 in every 8 in healthcare on medicines, €3.2 billion. And the good news is, with this new development funding over the last number of years, just in the last 3 years, because there'll be more this year, 148 reimbursement approvals have happened, either for new medicines or for additional uses for existing medicines. And I'm very happy to be able to report that of that, a great number, 40 or 50 of those, are for orphan drugs. I had believed, in fact, I may have even said it in the Oireachtas, that there was no money for orphan drugs. There were no orphan drugs being approved, and we didn't have a system in place to deal with that. But it turns out that a great number of the new reimbursement decisions are indeed for orphan drugs, which is very good to see. Now, more needs to be done. We've published the Mazars report. We are going to have a tracker in place so that patient groups and other stakeholders, the pharma industry and others, can see how these things are progressing. We need to be able to do more health technology assessments. We need to be able to do them quicker, and we need to be able to do more of them at the same time. And for that reason, this year we've allocated additional staff to the National Centre for Pharmacoeconomics and to HICWA and to the corporate pharmaceutical unit within the HSE, essentially the ecosystem of assessment teams in our public health service to make sure that we have greater transparency, greater capacity and greater speed in terms of assessing many of the treatments, many of the medications that are so important to the 300,000 people and all those in the future, all those people who will be born in the future, who need all of this as well. One of the areas I touched on was newborn screening. I think it's fair to say that Ireland probably has been a laggard in terms of the number of conditions that we screen for. We were at 9 when I took office. We're now at 11. We've authorised SMA and SCID. Hopefully later this year, MLD will be added to that. We have to see what the group says. I've doubled the funding. In the initial budget, we allocated 700,000 to help with the rollout of additional newborn screening diseases. I've doubled that now to €1.4 million to make sure that we can just crack on and do it. We need these screening services in place very quickly. And this really needs to be just the start. We have a really good expert advisory group who are looking at conditions right across the board, and I fully expect Ireland to catch up. And we must really aim and have an ambition to be among the leading countries in Europe, not just at the average. We are a wealthy country. We invest an awful lot of money in healthcare, and it's important to all of us that we aspire to be amongst the leading countries in the world in terms of newborn screening. One of the things that we have to continue to support as well is the international collaborations. The European reference networks are essential in terms of us sharing our expertise and in terms of learning from those right across the EU as to what's going on in their countries, often with much bigger populations than us, often with an awful lot of expertise that they can share. We're now members of 18 of these European research networks. I think it's going from strength to strength, and it's something we're going to continue to back, because certainly there is no way we could have the expertise on this small, beautiful island of ours, rather, to be able to cover all of the diseases. We simply couldn't do it. We're taking an international approach to this, and not just an EU approach, obviously. Our clinicians have links all over the world, be it in North America, Australia, other places as well, the UK, obviously, and we're going to continue to back them in being part of an international community in terms of the expertise that's required. One of the other big things we've done, and I know there's people in the room who are actively involved in this, is put in place a new steering group. As you'll all be aware, there was a rare disease strategy, but that rare disease strategy, the timing on it ended 6 years ago now. My observation was that whilst a lot of good work was happening, we weren't taking a strategic approach to rare diseases and to supporting people with rare diseases. So I asked the department, I spoke with the Chief Medical Officer, I asked Professor Smith to set up a working group to put a new strategy together for us. And what's very important in this strategy is that whilst of course it includes access to medications, access to science and technology, it's much broader than that. There hasn't been enough attention, in my view, on community care, on community networks of support right across the board. And what we want out of this strategy is not just very strong hospital-based care. We want to make sure that end to end we have a very ambitious plan for supporting people at home and the other issues which I referenced earlier on around genetics and screening and acute care and medication and social supports and mental health supports. Key to all of this, obviously, is the patient. The patient voice must be at the centre of everything that we do. I think some parts of the HSC or some parts of our public health services have done that well in the past, but not universally. And one of the big cultural changes that we're in the middle of at the moment is saying that the patient not only comes first, but the patient voice and the patient experience comes first. Probably the most successful action plan we have launched in the time of this government is the Women's Health Action Plan. We launched it 2 years ago. We did a 2-year action plan, and we designed the plan putting in place a women's health task force. They did a listening exercise right across the country, and they came back to the department and said, these are the services that women want, be they GP services, hospital services, community services. These are the services that women are saying they want. They are the services that we put together around fertility treatments, menopause, endometriosis, maternity services, perinatal mental health, eating disorder teams, and more. We're going to be launching a new 2-year plan in the coming weeks. But the big learning from that, which we are applying now to the new rare disease strategy, is everything starts and finishes with the patient voice, with the patient experience. And I know there are people in the room, I've met some outside earlier on, who've agreed to give up their time to be on that patient forum, and I want to thank you all very much for that. I also want to thank all of you who've agreed to be on the steering group as well. I know you're all very busy people. There are a lot of different demands on your time. This is a substantial piece of work that you've agreed to invest a good chunk of your time and your effort and your expertise into. So I really want to thank everyone on both the patient forum and the steering group for agreeing to do it. I think it's going to lead to a really important strategy. It's going to lead to an important improvement in supports for people living with rare diseases. So that's all I want to say today. Rest assured, this government is listening to you very carefully and very closely. We are going to continue to invest. We're building momentum. Having the new strategy is the best way to future-proof investment. When budgets come around, when you have a strategy that's been agreed, it's been verified, it has clinical governance, it has the patient front and centre, it's much easier to say, you know, we're going to give X million to the maternity strategy, the cancer strategy, the palliative care strategy, the rare disease strategy, rather than people within the HSE trying to work with officials in my department to say, can we have a bit of money for this thing over here, or could we have a bit of money for that thing over there? When you have a coherent end-to-end strategy, it's just easier to invest chunks of money into it, and then that money tends to get put to the best possible use with a clear strategic framework and governance. So best of luck putting it together. Be ambitious, as I know you will. I've no doubt it will cost an eye-watering amount of money, all of the strategies that come in do, but for very good reason, because those who are on those groups are demanding the very best on behalf of the children and the mums and dads and the adults and everybody who's living with or supporting someone living with a rare disease. So best of luck for the rest of the day. Thank you again for the invite, and we will look forward to a bright future where Ireland can proudly say we are one of the leading countries in the world when it comes to supporting people living with rare diseases. Gur Magwav.